This is a Healthy Breathing Habits Online Academy Session 2. Right now we're talking about posture. As you will soon understand very well, creating good posture is a lot more than just standing up straight. Today we're going to talk about what is good posture, then the typical posture and pain patterns people with dysfunctional breathing tend to develop as they jet their heads forward to catch more breath, ways to start physical training and body work to unwind many of those patterns. And then by the end of the hour, you will understand very well how chest breathing is connected to mouth breathing and poor posture, and nasal breathing to the diaphragm creates good posture. I'm Lisa Bowen. I'm your hostess today. I'm a breathing educator, a California massage practitioner, and founder and director of Breathing Retraining Center. We're in San Rafael, California. This is a good time to mention that this talk doesn't represent medical advice. I'm an unlicensed Buteyko educator and breathing coach, and even as a California certified massage practitioner, that is not considered a licensed healing arts practitioner in the state of California. Please run anything in this lecture that you're thinking about applying to yourself by your doctor or physical therapist or other licensed healing art practitioner. That's true every time I give one of these lectures, but it's really true with posture because it's very hard to assess yourself, even looking in the mirror. I'm sure even physical therapists and doctors have a colleague assess their posture and give them exercises because it's tough. It's tough to look at yourself. All right, so now let's talk about what's good posture. Well, we're looking at this woman from the front, and you can see how nicely her nose and the top of her sternum and her pelvis line up. So she's got very good posture from the front. Now, what we always do is look at people from the front and the side. So if you stand against a grid or a plumb line, which is how I've seen it in classes where the teacher brings in a string with a weight on the bottom, hangs it to a ceiling, and we all stand behind it, ideally the ear, shoulder, what they're calling the pivot of the hip here, I think would be the head of the greater trochanter bone, the knee joint, and the center of the foot arches should all line up in a straight line. Notice that the head is in alignment here. It's not forward. We're going to be talking about forward head position a lot shortly. So this woman has very good posture, very good alignment. Let's talk about sitting. Now you see that there's still that great straight line, and one thing that's important when we're seated, if we want to keep our airway straight and unobstructed, is that our hips should be higher than our knees. So when you're doing breathing exercises or sitting at your desk, or you can set up your dining room chairs correctly, put a pillow on the chair if you need that to get more elevation for your hips. Now, let's talk about misalignment. Let's talk about the different ways that people can express poor posture and the patterns, because typically there are patterns. Now, we're a breathing retraining center, so I'm going to talk about how mouth breathing contributes to the head forward position that is so prevalent and so hard on our neck. Okay, so the mouth breathing, people are mouth breathing, and how does this affect, why would they have their head forward? Well, in order to open the airway at the mouth, the head rests in the forward position and the shoulders slump, just to be able to catch a breath in that position rather than nasal breathing. Mouth breathing is also connected to chest breathing. It has to do with, we're supposed to be nasal breathing, so when we're mouth breathing, the body assumes that we're in fight or flight, And so so we start breathing more rapidly, and that means the air doesn't necessarily get down to the diaphragm. And then we start using secondary breathing muscles of the neck, shoulders, and chest that tighten, and that has an action too, which pulls the body forward, affecting our overall alignment. Lastly, mouth breathing changes the natural tongue position. When we're breathing through our nose and our mouth is closed, the position that our tongue should be in is resting on the top of the palate, right behind the teeth. Well, mouth breathers, typically the mouth can be hanging pretty much anywhere, and so that also ultimately changes our alignment. Just to bring this home more, here's a chart of all the things that happens as a result of mouth breathing. Mouth breathing really changes respiratory biomechanics and the exercise capacity. And I was thinking, it's hard to say, it's just like the chicken or the egg, which comes first? Which comes first, mouth breathing or this head forward position? I'm not sure. Does the head jut out to breathe easier because of obstruction, or does obstruction come because the head is forward? Forward head position is a well-known response to obstructed breathing and is common in children with chronic nasal allergy and mouth breathing, and because of this, the head position opens up the upper airways. Various studies have assessed body posture in mouth breathing subjects, and the consensus is that forward head posture is a major change. And the forward head posture will lead to disorganization of the muscle blocks. That's the anterior, front, posterior, back, and transverse muscles, impairing the diaphragm, muscle mobility, and consequently diaphragmatic function. This postural change also leads to accessory muscle recruitment, and with increased sternocleidomastoid muscle activity in the neck, that causes rib cage elevation, reducing thoracoabdominal cavity mobility, and compromising the ventilatory efficacy of the diaphragm. So all this means is everything gets messed up from what it would optimally do with mouth breathing, and then that leads to chest breathing and the use of the secondary muscles. So it's a negative stream. Okay. Now here you can see examples of the forward head posture and how it affects the whole body. So when you've got that forward head posture that tightens up those neck muscles, that affects the hips, the feet, everything's involved. So what's happening? The head forward shifts the center of gravity, so the upper body shifts back to compensate. At the same time, the hips tilt forward in response to the shift in the upper body, and the feet are doing something too, it's just not in this picture. Everything about our modern lifestyle contributes to this forward head position. So here's a fellow, and if you go into any coffee shop that has Wi-Fi, you'll see a lot of people who look like this. And so who's to say, you could have somebody who was breathing decently, had decent posture before they got their laptop, and all of a sudden they've got that head forward position, then they're breathing into their chest, their back hurts for multiple reasons, and that changes the structure of their whole chest cavity and how they're breathing. So it's really a conundrum. As we're going to discuss now, everything's connected, no surprise. And so if one thing's out of alignment, other stuff gets out of alignment too. And that's called, it's because of the kinetic chain, where movement of one joint affects the movement of another joint within the kinetic link. So now I'm gonna lay out common postural problems, and then after I've talked about all of them, I'm going to discuss things that you can do about it. Now we're going to talk about muscle imbalance and how it's systematic, predictable, and involves the entire body. Dr. Janda, who lived from 1928 to 2002, discovered patterns of weakness and strength of muscles in the overall population that are relevant to posture and misalignment. He had a super interesting story. He contracted polio at 15 and lived as a quadriplegic for 2 years. Eventually he recovered walking ability, but he used a walker all his life. He became a doctor and concentrated his practice and research on post-polio patients. And in 1979, so kind of towards the end of his career, he identified these cross syndromes that are very well known and worked with. And I am sorry to say I've got all these syndromes. I'm a former mouth breather. And so this is how I got interested in this, is that I was looking at ways to work with my own body, and I found out about a lot of this, and then I researched the exercises I should do. As a introduction, I want to talk about how muscles work in pairs. So for every action that the muscles are doing to move a bone, there's an opposite action to move it back. So here I've got an example of the biceps and the triceps. So what happens typically is that unless a muscle is totally in balance, one of these partners is tight and the other one is stretched out. And it's the stretched out side that hurts. People want that muscle massaged, and it feels better when it's touched. But to correct the problem, what you really have to do is release the tight side on the other side and then strengthen the side that's loose. So for many people, their back hurts, but what happens is it's their chest muscle on the front that's tight. And one of my massage teachers talked about how so many people's back hurt, and when she was at a festival, she would put people on the table on their backs and work on their chest muscle because that's what needs to be done. And this is a frequent topic of conversation in massage circles, is how much do you massage what people want massaged versus doing work on the opposite side to actually stop the source of the problem. So that's just a preamble to what we're going to be talking about. So what Dr. Janda uncovered was some patterns of how people's bodies work. So what you can see here is that for this head forward position, you've got tight upper back and loose neck flexors, and then tight pectorals. That's the chest muscles that I talked about. And then in the lower back, those are weak. So that's what you see is rounded shoulders, forward head posture, apparent curve in the neck and upper back. And what's happening is a weakening and lengthening of posterior upper back and neck muscles, and then tightening and shortening of the pec and the neck muscles. And all this depresses the sternum, making it difficult to breathe. And like I just said, how to correct it is that you stretch the tight muscles and strengthen the weak ones. And I'm going to say this for the next syndrome too. Now here's the lower cross syndrome, where this fellow has an anterior pelvic tilt and a sway back. You can see that here, the sway back. And now let me show you what the muscles look like. Same thing, he's got a tight low back, weak abs, tight hip flexors, and a weak butt. And so again, how you correct this is that you stretch these tight muscles on this cross, and you strengthen the abs, lots of sit-ups, and the butt, doing planks. Some people, including myself, have both these upper and lower syndromes together, which are really the biggest physical indicators are this forward head position and the anterior pelvic tilt. Now another thing that is known in the posture world is that, and this is kind of a buzzword now in fitness I think, is that many people have a weak posterior chain. All this means is that people's front muscles are tighter and yeah, they're tight, and then the back muscles are loose and need to be strengthened. And we're talking about the hamstrings, the back of the thighs, the glutes, the butt muscles, the spinal erectors in the back, and portions of the back neck. And they've talked about why this is so. And part of it is that people focus on the mirror muscles. That's what they call them, the part of their body that they can see in the mirror when they're doing these exercises. The other factor is that sitting stretches the back muscles, tightening the front muscles. So those are both reasons, and I've been at a gym where they were doing posterior chain workouts on a particular day. Now, unstable feet and ankles are all part of these syndromes that unbelievably start at the mouth. So I just want to talk a little bit about why this is. And also, I'll just say a little bit about why there's so much going on in a body as far as going back and forth, weak, strong, and some of the reasons. One of the reasons are the most important thing that the body is looking to create is that when we look out our eyes, we see the world straight. And the body will do whatever it has to do to create that straight vision. So if somebody is tweaked, say, in their hips, there's got to be another tweak in the shoulders or in the neck somewhere higher up so that the head is ultimately straight. And you see this with many people. So when there's a problem in one area, there's got to be a kind of a distortion further up so that the head and the eyes are straight. So anyway, down to the feet. The feet can be compared to a foundation under a building, and if the foundation sags, so does the building. My breathing trainer, when I told him I was having problems with my squats and what was going on, he said, "Oh, Lisa, people get old in their ankles," and so I really started doing my ankle exercises. It's so intricate. The foot has 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. So you really want to take care of your feet. And of course, when you have a foot problem, they say it really starts at the hips, and that's why the knees and the feet are splaying the way they are. Here is a picture of the various things people's feet can do. And chiropractors say that 77% of their patients surveyed have mild to moderate overpronation, which is what's going on in the bottom picture. That's when the arches collapse and the ankles roll in. You're probably familiar with the term pronation. It turns out that there's two types. The good pronation, which is at the top, purposely directed from the hips to unlock the foot in preparation for the heel striking the ground during gait, and that enables a foot to cushion the impact. Hyperpronation is bad pronation. It has its origin in the skeletal structure of the feet. It causes the longitudinal arch to collapse, ankle to roll inward when the foot becomes weight-bearing. And hyperpronation causes an internal rotation of the lower extremities. That's when your knees go in. Yeah, I'm just looking at this thing that talks about how just this, what's going on in the feet, affects everything up to your mouth. Here's how it goes. Because the left foot typically hyperpronates more than the right, the asymmetrical internal leg rotation typically causes the left innominate to be pulled forward and down more than the right, causing an unleveled pelvis and a functional leg length discrepancy. And then these displacements cascade up the axial framework, and scoliotic and kyphotic curves are exaggerated in the spine, and then the thoracic cage usually twists counterclockwise. The left shoulder usually protracts more than the right, and the right shoulder drops. And then the maxilla, that's a bone in your jaw, moves anteriorly, that's forward, causing an overjet bite. So, needless to say, that's a lot going on just because your feet are turning. But it happens all the time. Okay, now I want to go back to the respiratory system and talk about the biomechanical and postural issues that affect ease of breathing. Now, just so you know, when you're considering your posture and your physical structure in relation to breathing habits, it makes sense to get a physical assessment of how you're breathing by an osteopath, a physical therapist, or other health professional qualified to do an exam. So I'm going to talk about some common things, but you really, just like I was saying, you want to watch someone, or you want to have someone watch you standing against a grid or a plumb line, and then assess what muscles need to be strengthened and what needs to be released. More of the same here. You want someone to watch you breathe and palpate. That's touch your primary and secondary breathing muscles while you breathe in various positions. Check out your diaphragm movement and pay a lot of attention to your rib cage. Like any other area of the body that moves and turns, there can be more or less flexibility in your whole chest area. Many people's chests are rigid, and the goal of professionals is to want to decrease this chest rigidity and, create more range of motion, just like any other joint or muscle group or part of the body, right? The more you can move, the better. Rigidity comes about because of tight muscles as well as this rib cage mobility issues I'll talk about in the next slide. We're supposed to use the diaphragm for 80% of our breathing. And if there's mouth breathing or other less than optimal patterns, people will use the secondary muscles like the SCM and the scalene here, showed in the picture on the right, at the neck. And then there's muscles between the ribs, and some of these are used on inspiration, others on expiration. So which ones are short and which ones are tight can be indicative of a particular poor breathing pattern. So this is the soft tissue issues. Now let's talk about the ribs. So professionals will do a rib assessment to see if they're elevated or lower than they should be, especially the first ribs. Those are the ribs at the top, right up there. Now, any rib can be locked into its inhalation or exhalation position. And if that's the case, it needs to return to a flexible position for you to feel an open chest, without constriction. And they'll check also if the ribs expand laterally or out when you breathe. That's really the whole point of this picture, is that ribs are expanding when you breathe. And then, I don't want to say contracting, but they're moving in and out. So, how they work with the ribs is to work with the muscles that are in between them. So I don't want to talk about any more details. I don't want to talk about any more details right now. The point is that if you feel this type of tightness, or if you have any reason to think that, hey, I'd like to get my chest checked out or my posture, I've really worked on my breathing, and I think I have pretty good healthy breathing habits, but still I'm not comfortable, this would be an excellent thing to do. All right, now I'm going to talk about ideas to correct posture. And now again, remember, this is super general. See a trainer or a health professional for an assessment of your posture and the corrective exercises for your body. Again, let's talk about the chest and the breathing muscles first, since we just covered the anatomy. You want to see an osteopath to diagnose tight muscles, and then a massage therapist or a physical therapist can relax them. You can also work with a breathing training device to strengthen your breathing muscles. The power lung is a prime example, and the breath slim. Oh, I'll just say one more thing about this, that I used to play the flute when I was a kid, and I had a type of, it was a breathing retraining device, but they didn't call it that, I blew into it, and the job was to keep a ball in the air. So there must be a good 50 of these on the market, all with different goals, and it's all good. Let's talk about releasing tight muscles. So you can have a session with a professional body worker, massage therapist, rolfer, chiropractor, osteopath. It's all wonderful, and I recommend that you get an assessment. I have noticed that many massage therapists work on themselves, and I want to explain to you how you can do this. First of all, there's stretching, which again you can do with a professional. Stretching really should be done every day. So optimally, how you want to work with your professional is that they show you what to do, and then you go home and do it, and then you come back and you have another session, and they assess where you're at and what's the next step. So daily stretching. Daily self-massage. You can use a tennis ball, any place, any part of your body that hurts or is sore, you can rub. Or if you want more pressure or some sort of release, you can rub it with a ball. And if it's on the front, you can just rub it. If it's on the back, you can have the ball between you and the wall or you and the floor. That's a way for you to get your shoulder or your scapula area in the back. There's also these rollers. I've got two pictures of rollers under the ball here. I've got a handheld roller, and what I do is I've used these on my quads. That's the front of my thigh when they were really tight. That's the main place I used it as a massage therapist. I've used it on cyclists' hamstrings and calves. And then on the right is this white roller, and that's something, again, that you can roll over. And there's different colors based on the hardness. The white is the softest typically. Different manufacturers have different systems, but what I've experienced is that the white is the softest and the black is the hardest. So what this is doing is working on your fascia, which is the covering of the muscles and organs. That's a whole other subject, but anyway, this stuff can get tight, and so you can have a restriction in one place, then you actually are feeling pain somewhere else. But what you can do, any pain, any thickness in your muscles, whatever, you can't hurt yourself rolling it out. And if you're going to roll your legs in particular, your IT band on the side of your legs, it can hurt until you've done it for quite a while. But it's really good for you. Last is, down at the bottom here is a picture of a Theracane that you can, just so you can get an area in the middle of your back or someplace that you wouldn't necessarily be able to apply some pressure, you can use this cane. And I used it in conjunction with a trigger point book where I looked up the place where I was feeling pain and then where the possible trigger points were, and it was great. So these are all options to release tight muscles at home. And again, I suggest you get an assessment first, get some professional advice, and then do what they tell you every day. You can do it in a meeting. Now for upper cross syndrome, remember that was where the head forward position was and the rounded shoulders were the characteristic look. So I'm not going to go into detail on these. If you want, you can Google them. But chin retractions are basically just practicing, what would your head look like if it was not forward, and that's basically you retract your chin. Things to just do the opposite of that forward shoulder movement in, that look when you're leaning over the computer, would be to squeeze your shoulder blades. Another thing you can do is stretch your chest muscle by holding your arms out behind you, and I'm sure you've seen people holding on to a door jamb on either side. Doing that. I'm doing that as I'm talking about it. Overhead thumb press is stretching the shoulder area, and the scapular wall press. Now, to work on the lower cross syndrome, which had the anterior pelvic tilt and the weak butt and just problematic ankles and knees, you can do lunges and bridges and planks from yoga and Pilates, downward facing dog, it's another yoga move, and then various ankle exercises. That's really an area to get professional help, is which way your ankles are going and which exercise you can do. Because remember, I think I said before, there's something like 100 muscles in your feet. You want to make sure that you are strengthening and relaxing the correct ones for you. Okay, another thing to talk about is, and this is in the area of retraining muscles and strengthening weak ones, is strengthening the tongue and realigning the swallow for people who mouth breathe. Because the thing is that for people who haven't been nasal breathing, their tongue is all over the place and they're not swallowing correctly, and this is problematic. My daughter sees someone who does orofacial myology. This actually, who recommended it was her, or soon-to-be orthodontist, because if you can't nose breathe, then your tongue is all over the place. The tongue is, see how in this picture the tongue is pushing the teeth forward? The tongue should sit or rest behind those front teeth and never move forward. And the tongue actually has a tremendous amount of pressure on the teeth. So the tongue is your first retainer if you use it right. And in fact, what happens is if the tongue is sitting on the top of the palate, then the whole jaw grows around the tongue, and there are enough space for all the adult teeth, because a lot of kids these days are wearing expanders. So this also has implications, as we've talked about, the kinetic chain all the way down and certainly into the chest. So this is also work that people who have sleep apnea often do with great success, is strengthening the muscles at the back of their tongue, the back of their throat. So it's another type of work that someone can do. All right, in the area of lifestyle tips for posture, don't carry heavy bags, backpacks, or purses. That tightens the shoulder muscles, and specifically on that one side. And then you have a alignment issue that you can see from the front that has other implications. When you're at a computer, get up at least every half hour and buy a supportive neck pillow for your bed if you wake up with a sore neck. Review your ergonomics. Is your computer monitor the right height? Hold cell phone and tablets up so your handheld doesn't... Oh, I got a typo here. Hold cell phone and tablets up so, I don't know what doesn't drop. Oh, so your head doesn't drop, and lengthen the back neck muscles. This, to me, is a real travesty going on with young people, is how they just are looking down at that handheld. My daughter will do that, and I'm like, pick it up, you know? Okay. Now, for the sake of your posture, it's a good idea to change your breathing path away from mouth and chest breathing to nasal breathing into your diaphragm. Because, as I mentioned in session 1, nasal breathing into the diaphragm creates the rest and relax state, and the mouth breathing is rapid, and it goes into the chest typically, and it creates fight or flight. So start a nasal breathing program. And practice feeling your diaphragm. There's many ways to do it. The one that is traditionally offered is to lay on your back and put phone books or sneakers or something on your chest and your diaphragm, and see which part of your body moves first when you inhale. And then practice until you can make the diaphragm go up first. I just saw this other idea last week, which is to lay on your tummy and feel your diaphragm push into the floor when you breathe. So no tools needed. So just an admonition that the restoration of functional breathing and posture go hand in hand. And so, yeah, we really need both. And I have read several books about actually all the things that physical therapists and osteopaths do for people with dysfunctional breathing, especially when they have a serious respiratory disorder like COPD. They're really working with folks' physical structures to make it just as easy as possible. Thank you very much. If you want to get in contact with me, here's my info, and I look forward to seeing your before and after pictures. Thank you.